a first in our lifetime pandemic. As the COVID-19 virus spreads rapidly, healthcare providers rely on preparation and training to get through this once-in-a-century challenge together.
And when we say together these days, we often mean right here on video calls, as we are all practicing social distancing. So today on this video call is Tim Bowen. Tim is the CEO of the nonprofit Care Synergy Network. Care Synergy supports 4 hospice providers and 1 home health care provider in Colorado. Now, Tim, your affiliates are working with patients and their families who are already going through an intensely emotional time. And now all of a sudden there is this, the COVID crisis. How do you get through this?
Yeah, thanks, Baji. That's a really good question. First, I want to recognize all of our staff who've been remarkable in their response, professional in their attitudes, and committed to the patients and families that we're privileged to serve. I'm proud of all of them and what they do each and every day. Make no mistake, this is a very challenging time, unlike anything we've ever seen or experienced. And at times, I think some of us feel overwhelmed. And when we do, we need to remind ourselves that we will get through this. We'll get through this by supporting each other, by being there for each other, and helping each other out.
I imagine that one of the benefits of being part of an affiliate network like Care Synergy is being able to coordinate and to work together. How are you able to support your affiliates in these times?
Absolutely. That is the benefit of the Care Synergy model. And for us, PPE, personal protective equipment for staff, has been the critical piece of this puzzle. One critical way we've been able to leverage the strength of Care Synergy and our enterprise has been in securing the PPE for all of our affiliates. One of the things that we did when all of this started was to take an existing inventory and across all affiliates, and then really centralize the acquisition of PPE. This is literally a daily grind to identify the sources and secure the PPE. We're in a much better position today than when this whole pandemic started. But we have to remain diligent in this effort. And the national stockpile and the state distributions have had very little benefit to us. I've had a number of staff reach out to me and ask about the CARES Act that they may have recently heard about that was passed. And unfortunately, we looked into it, but we're not able to benefit from it. We're considered one employer, not 6, and we have more than 1,000 employees. So we're trying to help our affiliates apply for other sources, funding sources that have become available through this pandemic. One of them is Help Colorado Now Fund, and so we're working with all of the affiliates to make sure we're putting in applications for those funding sources. To really help with the unanticipated expenses due to this pandemic, particularly around the increased need for PPE.
Tim, many of your employees are healthcare workers, absolutely essential workers during these times. How are you able to support them and their families?
We're trying to support all of our employees in the very best ways we can. For office-based staff, most now work from home remotely. For clinical staff in the field, we do as much as we can remotely, certainly ensuring that they have enough PPE to do their jobs safe and effectively. And then we want to limit their time in our offices. We're trying to make sure that all of our employees' health benefits have been expanded, particularly in relation to the COVID-19 issues. So we've worked with Cigna to expand our health benefits so that co-pays and deductibles for anything related to COVID treatment or testing has been waived. We've also tried to expand our PTO allowances. So if employees get sick or their family members get sick, we know they're going to need time for recovery and or caretaking. So we've extended our paid time off benefits to allow staff to go negative or go in the hole or use up to 80 hours that they haven't yet earned. We're looking at everything else we can find in the state of Colorado to help our staff. One of them is emergency childcare that's supported through the state of Colorado, particularly for essential employees, which our staff are considered essential. We're working with Cigna to find other resources in our healthcare network that may benefit staff. And then recently, in January, we expanded the benefits to include work-life partnership, which is a unique employee assistance program that's a terrific resource for employees, particularly at this time. It's confidential, and I hope staff are reaching out to them.
Tim, I thought it was interesting that you have an ethics committee that's meeting throughout this pandemic.
We do. Care Synergy has an enterprise-wide ethics committee, which is made up of about 20 individuals from all 5 affiliates. We also have 4 individuals on the ethics committee from the community who are not connected to Care Synergy or its affiliates. And we're proactively trying to use this committee to identify and discuss, some of the real ethical dilemmas that we're now facing, or frankly may face in the near future from our work with COVID. And so we're trying to proactively use the ethics committee to help us as an enterprise develop plans and strategies to meet the COVID challenges.
Certainly, there are big challenges these days, Tim. We wish you and all of your affiliates the best in this. Tim Bowen is the CEO of Care Synergy. Thanks for your time today, Tim.
Thank you, Liza.